Mr. Secretary, over the last few years, our veterans' medical needs have really grown, which has, of course, required more funding to ensure that they are getting the care they need. And this growth in spending has put significant pressure on our non-defense discretionary budget. Medical care is an earned benefit of service, and this committee has always ensured that VA has the resources to meet our veterans' medical needs. This year's budget request assumes relatively flat funding in discretionary medical care accounts and a higher rate of growth in spending on treatment for toxic exposed veterans in the Toxic Exposures Fund. Can you tell us what is driving that assumption?
Yeah, the main ip is the one that you identified in your opening statement, which is that our initial requests were submitted before the establishment of the TEF. We have a very simple principle at the department, which is that we're going to use TEF for TEF, meaning as the PACT Act envisioned, any incidental dollar above FY21 base for toxic exposure will be funded through the Toxic Exposure Fund. We think that's in keeping with the statute, therefore in keeping with what congressional intent was, but also allows us, as we have in the past, for example, with the Mission Act and before that with the Choice Act, to establish very clearly where those additional dollars are going. And so we've talked through this methodology, that the way we've come to the $20 billion marker in the TEF with your teams. We'll continue to work through that with them. My commitment to each of you, going back to last summer, that we will be very transparent about how we spend the money in that TEF remains. I've also had conversations with our Inspector General to ask him to increase his oversight as it relates to our use of the TEF. But that's the real issue. It's an accounting issue, and it's our desire to try to be consistent with congressional intent in the PACT Act from last summer.
Okay, and given the relatively low growth between fiscal year 2024 and 2025 in advance, is VA anticipating a large second bite request next year?
No, in fact, we'll obviously, we do not anticipate that today. We'll obviously be clear with you and transparent with you if we get a sense that we'll need it, and I know, you don't traditionally appreciate the second bites. We don't necessarily anticipate one today. That's because a range of things, including one of the issues that Senator Boozman raised, which is we do have some unobligated funds from the pandemic. We anticipate using all of those, and that will obviate the need for us to come ask for a second bite. So I never want to say never, but we feel pretty good about how this year and the out year look.
Okay, and as we've talked about last year, Congress did pass the PACT Act, so we can fulfill our commitment to make sure veterans receive the care and support they earned, including veterans who experience toxic exposures. And I really do appreciate VA's commitment to implement the law swiftly to make sure our veterans get this care. Based on what the department has experienced to date, what is the demand for health care and benefits related to the PACT Act, and how does it compare to your initial projections?
Yeah, we're anticipating, we have kind of two projections that we're tracking. One is claims filed, and how a sub category of that is how we anticipate the backlog tracking with claims filed. So far, on both of those things, we're about spot on our assessment for how many claims we anticipate being filed this year. We're about 30% above where we were a year ago today. The backlog, we're a little bit ahead, meaning we're overperforming our assessment as it related to how much backlog we anticipate. Nevertheless, we'll continue to track that closely. We publish that number every Monday morning on our website. We'll continue to brief your teams about that. That's on the claim side. On the care side, we anticipated veterans using this open enrollment period during this year, as anticipated in the Act, to come in and seek additional care. To be honest, I think we're a little softer in terms of new care being provided to veterans in this window than we would have anticipated. But again, it's pretty early in
Meaning
this
there's
process.
fewer?
Meaning there's fewer than we anticipated. But we still see net over 10 years, we're looking at between 750,000 and 1 million new veterans, and then obviously an intensification of services among veterans already in our care.
Sure, I can't let you leave without a discussion about EHR.
Yes.
It has been almost 5 years since the VA signed a contract with Cerner to implement this new electronic health record, as you well know. And as you also know, I've raised concerns from my constituents in Spokane and Walla Walla about the usability and reliability of the system and some very serious patient safety concerns. You've announced a reset of the EHR program, which follows an assess and address period after an extended pause, and I do support efforts to move forward only after you are confident about the safety and effectiveness of the system. VA and Oracle Cerner are responsible for the system not working the way it should. You have said that during this reset period we're now in, that VA will prioritize stabilizing existing sites. How is that different from the pause and the assess and address periods? And when will we see Spokane and Walla Walla back to pre-EHR productivity?
Yeah, thank you very much. The main difference is that we've said very clearly that we're not going to try to do both these things at the same time, namely continue to prepare for further deployment and make it right in Spokane, Walla Walla, White City, Roseburg, and Columbus. The bottom line is we are going to invest in those 5 sites to make sure that we get it right, and to make sure that we know this is get it right-able. And I was just in Roseburg last week, hearing directly from our clinicians there. The whole point is to focus just there to prove concept. I will say this: we had 7 months with no system-wide outages. Unfortunately, in the last 2 weeks, including yesterday, when we had an outage for 224 minutes across the entire VA and DoD system, we're now reset that back to 0. The most important thing, meaning set it back to 0 from 7 months of actually at least no outages. That doesn't mean across the system it was functioning perfectly even. So I am extraordinarily frustrated with this. I know our providers and our veterans in Washington and in Oregon and in Ohio are extraordinarily frustrated with this. The whole point of this point of this reset is clear away everything else. Let's focus on the 5. Let's get it right, and then we'll talk about onward deployment.
Okay, and how does that affect your fiscal year 2024 budget request?
Well, we want to work through that with you. We know that for FY23, in the first instance, we estimate that there's probably $400 million that we won't need in light of this decision, and that we'll want to work through with you the specifics on the FY24 request. But the bottom line is, I think it stands to reason that that request will look different.
Okay, look forward to working with you on that. And I just want to mention childcare today. This is such a challenge for families. People
Totally.
are not taking their appointments, can't get to appointments. Childcare is an issue. And I was really pleased, as I mentioned in my opening remarks, that the budget outlined a plan to extend the childcare pilot. American Lake in my home state participated in that. But I understand that we don't have regulations and dedicated resources to IT development, so we can expand that. What is your timeline on doing that?
Well, we do want to be fully operational in 26, and we think that that will mean 300,000 veterans with access to this. But to get fully operational in 26, we need to see functioning sites in 24. So it is true that the regulation writing is lagging right now. But I think to a certain extent, that's to be expected with a new nationwide program. But our commitment is to get this deployed in '24, eventual to full deployment in '26, with 2 options for veterans: drop-in services when you're coming in for a covered appointment, or contracted services. It's the contracted services that needs the IT help. And so we're working with the Office of IT on that. And I was just in Seattle and met with the team that had run the pilot. So I'm continuing to keep pressure on our team here. We're determined to meet these goals laid out in the program because the president expects us to, but as importantly, because our vets need it.
Thank you. Senator Boozman?